Hello, my name is Alicia Jernigan, and I'm going to be completing my head to toe assessment. Today is May 30th, 2024. This is Ivy. She's my patient. I have washed my hands and obtained consent, and now I'm going to scan my room. Okay. Put this. Okay. All right, now we're ready to begin. I'm going to start my head to toe assessment right now. Okay, we're going to start with the skin, assessment of the skin. I am looking on both sides for color, temperature, turgor, texture, moisture, edema, bruising, scarring, lesions, nevy, particularly on the face, neck, chest, abdomen, and back. Then I am going to inspect the scalp. I am looking at hair distribution, color, texture, and I'm going to palpate her scalp. I am looking for any infestations, depressions, masses, any areas of tenderness. Then I'm going to palpate the temporal arteries for tenderness. Then I'm going to palpate the lymph nodes, preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Then I'm going to palpate for TMJ. I'm going to have you open your jaw for me, okay? And I am palpating to see if there's any tenderness. I'm also looking for any crepitus or subluxation when I do that. Then we're going to assess for cranial nerve 5, which is the trigeminal nerve. I'm going to ask you to clench your jaws, okay? And I can feel the masseter muscle contract there. That's the motor portion. And then the sensory portion, I'll have you close your eyes and tell me if you feel me touch your forehead. Yes or no? No. Cheeks?
Yes.
Chin? Nose. Do you feel me touch those areas?
Yes.
Okay. All right, so cranial nerve 5 is intact. Cranial nerve 7 is the next nerve that we're going to assess for, and that's the facial nerve. So I would like for you to I'm going to ask you to smile, frown, pucker your lips, puff your lips, and raise your eyebrows. And we're looking for symmetry on both sides of the face as she does that. Okay, then next we are going to assess the ears. I am looking at the external ear. I'm looking for size, shape, position. Then I'm going to palpate the pinna and the tragus. I am looking for any masses or any tenderness in the area. And then I am going to use my otoscope, and I am going to look into the auditory canal, and I'm going to look on both ears. Okay, and I am looking for any redness, discharge. I'm also looking at the tympanic membrane for any bulging. I'm looking to see that the tympanic membrane is pearly gray in color, and looking for the light reflection and the position of it also in both ears. Then we're going to assess for cranial nerve 8, which is the auditory nerve. So if you'll cover your right ear, and I'm going to whisper something, 1, 2, 3, and then cover your other ear, 1, 2, 3. Did you hear me whisper for on both sides of your ear? Okay. So cranial nerve 8 is intact. Okay. And then we're going to move to the assessment of the eyes. So I'm going to inspect her eyes. I'm looking for symmetry. I'm also looking at the lashes, the brows, the palpable fissures, and I'm looking for any lesions, any discharge. And then we're going to inspect. Also, we're going to look at the sclera. I'm looking at the color of her sclera. I'm also looking for any lesions or discharge there, and looking at the conjunctiva of her eye, looking for the color also there. Then we're going to check for cranial nerve 2, which is the optic nerve, and we're going to assess for gross visual acuity and also peripheral vision. So on this one, we're going to use the Snellen chart for gross visual acuity, standing at 20 feet. If you'll cover your right eye and read this line for me.
OLCF.
Okay, and then cover your other eye. Read the same line.
OLCF.
Okay, and then read it with both eyes open.
OLCF.
Okay, and that is correct. So her visual acuity is 20/20 in both eyes. And then I'm going to stay. I want you to look forward and tell me, do you see my fingers move on the side?
Yes.
Okay, and then do you see my fingers move on the side?
Yes.
Okay, so peripheral vision is intact as well. Then we're going to assess cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens. So for oculomotor, we are going to use the pen light, and we are looking for pupillary response. Okay, and there is direct pupillary response with consensual constriction of the opposite eye. And then I am going to check for accommodation and convergence. So if you'll pick a spot on the wall behind me, just look at a spot on the wall. Just
Okay.
Look at the wall behind me, and then now look at my pen light. Follow it to my nose. Okay, so accommodation and convergence are intact. And then I want you to watch my pen light, and we're going to do the 6 fields of cardinal gaze. So if you'll follow my pen light without moving your head. Okay, cranial nerves 3, 4, and 6 are intact. Okay, then we are going to assess, then we're going to use the ophthalmoscope, and I'm going to look at the okay, and here we're assessing for the red reflex and also visualizing the optic disc. Okay. All right, so next we're going to assess the nose. I'm looking that the nose is straight in midline. And then we're going to assess for cranial nerve 1, which is the olfactory nerve. If you'll close your eyes for me and tell me what you smell.
Lemon.
Okay, that's correct. And then if you'll hold one side of your nose and blow out, and the other side and blow out. Okay, and then I'm going to look at your turbinates. Okay, I'm looking at the turbinates for color, any discharge, and then I'm also looking at the nasal septum to see if there's any deviation. So cranial nerve 1 is intact. Okay. Next, we're going to assess the mouth. So I'm going to inspect the lips, the gums, teeth, tongue, salivary glands, buccal mucosa, the soft palate, and also the tonsils. And open your mouth, okay? And I'm looking for color, moisture, any lesions inside the mouth. And then Also, I will grade the tonsils, and her tonsils are a grade 2 if the tonsils are present. Okay, so then we're gonna assess for cranial nerves 9, 10, and 12, which is glossopharyngeal, vagus, and hypoglossal. So if you'll open your mouth and stick your tongue out, and then move your tongue side to side. Okay, and then say ah. Okay, all right. And we're looking for that her tongue it's midline. There are no fasciculations, and then also her uvula rises and falls with phonation. So cranial nerves 9, 10, and 12 are intact. Next, we're going to assess the neck. So I'm looking at the trachea. Her trachea is midline. And then we're going to assess the thyroid, and we would do that from behind. And I'm going to have you swallow for me while I palpate. Okay, and that feels normal. Okay, and then we're going to palpate for a carotid pulse on the right. Okay, and then I'm going to palpate for a carotid pulse on the left. Okay. And then we are going to listen for a carotid, to see if we hear a carotid bruit on either side using the bell of the stethoscope. If you'll hold your breath for me. Okay. And hold your breath. Okay. And no bruit is heard. Okay. So next we are going to we're going to do the posterior chest. So if you'll take in if you'll turn your feet to the edge there. Okay, and on the posterior chest, I am looking for symmetry. I'm looking for any deformities. I am going to check for bilateral chest expansion. Take a deep breath. Okay, and her chest rises symmetrically as she takes a deep breath. Next, I am going to check for tactile fremitus. So I'm going to have you say 99.
99, 99, 99.
Okay, all right. And then I'm going to percuss all areas of the lungs. Okay, and tympani is heard throughout. And then I'm going to listen to lung sounds in all the lung fields using the diaphragm. Take a deep breath. Okay, listen to all lung fields. Her lung sounds are clear. Now we're going to listen for a gophony. So as I listen to the lung sounds, I would like for you to say the letter E.
E, 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 E.
Okay, now we're going to listen for bronchophony, and we're going to have you say 99.
99, 99, 99, 99, 99, 99.
Okay, and then we're going to do whisperilliquy. I'm going to have you whisper 1, 2, 3 as I listen, okay? 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, and that sounds good. Okay. And then we're gonna go to the anterior chest. So if you'll turn your legs towards me. Okay, and I am inspecting both the front and the back. We are looking for any signs of respiratory distress. So I'm looking for any cyanosis, tachypnea, tripoding, nasal flaring, retractions, any signs that would say that she's having difficulty breathing. And then I'm going to check for symmetrical chest rise and fall. So if you'll take a deep breath for me. Okay, and her chest rises and falls symmetrically. Now we're going to do tactile fremitus on the anterior chest. So say 99.
99, 99, 99.
Okay. And then we're gonna listen to the lung sounds on the front of the chest. Auscultate the lung sounds. Okay, and the lungs are clear throughout. So now we're gonna move into the cardiac assessment, and first we're gonna listen to the heart sounds. I'll first listen with with the diaphragm of my stethoscope in all different areas, starting with the aortic, which is on the it's the second intercostal space, right sternal border. And then we're gonna move to the pulmonic, second intercostal space, left sternal border. Erb's point, which is third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And mitral valve, which is fifth intercostal space, mid-clavicular line. Then I'm gonna go back and listen through all the same areas with the bell of the stethoscope at the aortic, the pulmonic, Erb's point, tricuspid, and the mitral valve. Okay, and then we're going to locate the PMI, the point of maximal impulse, which is at the fifth intercostal space, mid-clavicular line, and we're gonna palpate this area. We're also going to feel in all areas for any heaves or lifts, which I do not feel. Then we're going to listen for a full minute for our apical pulse. And as we listen for a full minute, we're checking for rate and also to check the rhythm of heart. Okay, and then we are going to have the patient lie back at 30 to 45 degrees. So if you'll lay back for me. Okay, and then we're going to listen to the heart sounds again in all areas of the heart using the diaphragm and the bell in the same areas, starting with the aortic, pulmonic, Erb's point, tricuspid, and mitral. Then I'm going to listen with my bell, aortic, pulmonic, Erb's point, tricuspid, mitral. Okay. While she's laying back like this, we're going to look for any jugular vein distension. If you'll hold your breath for me. Okay, and we're looking on the right side and then also on the left side. Hold your breath for me. Okay, and there is no jugular vein distension noted. Okay. While she's laying back, we're going to move into the abdominal assessment. I am going to inspect the abdomen. We're looking for contour and symmetry of the abdomen. First, we're going to auscultate. I'm going to listen to the arteries of the abdomen using the bell of the stethoscope. I'll be listening to the aorta. And then I'll listen to the renal arteries on the right and the left, the iliac on the right and the left, and then the femoral arteries, the right and the left. Okay, and there's no bruits heard. Okay, then we are going to auscultate bowel sounds, and we're starting in the left lower quadrant. We're starting in the right lower quadrant. We're starting in the left lower quadrant, going to the left upper, right upper, right lower quadrant. And bowel sounds are normal active. Then we're going to percuss in all areas. And there's tympany heard throughout over the bowels. Then we are going to do light palpation in all four areas and we're checking for any masses or tenderness. Do you have any pain? Okay, then we're gonna do deep palpation in all 4 areas. Okay, does that cause any pain? There are no masses felt. Then on the, then we're gonna see if we can palpate the liver, and we're gonna hook our fingers up under the ribs here on the right side, and then we're gonna see if we can feel the spleen on the left side, and those are not palpable. Okay. Okay. And that'll complete the abdominal assessment. So if you'll sit up for me, just sit just like that. And then we're also gonna check for CVA tenderness, and we're gonna do that. I'm gonna check it on the right and the left. Okay, did that cause pain in any way? Okay, all right. Okay, so now we're gonna, if you'll turn your feet towards me. Now we're gonna move to the musculoskeletal system, and we're gonna check for the upper extremities. We're gonna be inspecting and palpating the joints of the hands, the wrist, elbows, and shoulders, and I'm palpating and looking for any swelling, redness, nodules, any tenderness in those areas. Then we're gonna check for capillary refill on both hands, and capillary refill is less than 30 seconds. And then I'm gonna feel for a radial pulse on both the right and the left side. Okay. All right, then next we are gonna check range of motion of the upper extremity. So first we're gonna do range of motion of the fingers. So we're gonna do flexion, extension, hyperextension, and then adduction, abduction, and then thumb opposition. Okay. All right, and then the wrist, we're gonna do flexion, extension, hyperextension, and then ulnar deviation, radial deviation, and rotation. Okay, and then the elbows, we're gonna flex, extend, hyperextend. Okay, and then the shoulders, you can stand up if you want to for this one. The shoulders is gonna be, we're gonna flex, extend, hyperextend, and then adduction, and then abduction, adduction. Okay, and then circumduction is going to be around. Okay, and then internal rotation and external rotation. Okay, very good. All right, now you can have a seat, and we're going to check for strength of the upper extremity. So if you'll squeeze my hands, okay, and then I want you to take and push against my hands, and then do like this, and then pull against. Okay, and then I'm gonna push down. I want you to shrug your shoulders, and I'm gonna push down on your shoulders. Don't let me push down. Okay, and the shoulder shrug is testing for cranial nerve 11, which is the accessory nerve, and that is intact. So our hand upper extremity strength is 5 out of 5, and now we will upper extremities. That completes the upper extremities, and now we're going to move to the lower extremities, and we're going to be assessing for the joints of the feet, ankles, knees, and hips. I am also looking and palpating all of the joints. I'm looking for any tenderness, redness, swelling, any nodules, crepitus, anything like that in those joints. I'm going to check for capillary refill on both of the feet, and then I'm going to check a pulse on both feet and the dorsalis pedis, and then also the posterior tibial on the left and on the right. Okay, and pulses are 2+. And then the radial pulses, were also a 2+ on both sides. Okay. Next we're gonna do range of motion of the lower extremities. So I'm gonna sit down beside you and show you what to do. So of the toes, we're gonna flexion, extension, hyperextension, adduction is putting them together, abduction is apart. Okay, and then the ankles, it's gonna be dorsiflexion, plantar flexion, eversion, inversion, okay, and then rotation. Okay, and then the knees, if you'll stand up, you're gonna flex, extend, hyperextend on both sides, flex, extend, hyperextend. Okay, and then the hips, we're gonna flex the hip, extend, hyperextend. Okay, and then you're gonna do internal rotation, point your toes in, external rotation. Okay, and then abduction, adduction, circumduction. Okay, and we're gonna check that on both the right and the left side. Okay, if you'll sit down for me. And then we are going to check the strength of her lower extremities. So if you'll take your feet and push against my hands, push against, now pull, use your toes and pull against. Okay, and now raise your knees high as you can off the floor, and then push down. Okay, now push your knees out. Okay, and then don't let me push your knees out. There you go. So her strength of her lower extremities is a 5 out of 5 as well. Okay, next we're going to check for cerebellar coordination. If you'll stand for me. For cerebellar coordination, we're going to do first the hand flap. You're going to flip your hands back and forth as quickly as you can. Okay, that's good. And then I want you to touch my fingers as quickly as you can, alternating hands.
Oh wait,
like alternate your fingers to mine. Okay, all right, good. And then thumb opposition. Okay, that completes cerebellar. Okay, and then sit down for me. All right, and then I want you to close your eyes, and I'm going to place an object in your hand, and you tell me if you can tell me what it is. Open your hand.
a coin.
A coin. And then I'm gonna place something in your other hand. Okay, what is that?
Paper cup.
Okay, and that is tested for stereogenesis, and that is intact. If you'll hold your hand up for me, I'm gonna write a letter in your hand, and you tell me what it is.
A.
Okay, and your other hand?
C.
Okay, and this tests for graphesthesia, and that is intact. Next we are going to, I want you to keep your eyes closed and tell me if you feel me touch both of your arms.
Yes.
Do you feel me touch your legs?
Yes.
Okay, so light touch is intact in all 4 extremities. Then we are going to check for a vibratory response at the ulnar prominence. So if you'll hold your arms up for me, do you feel the vibration?
Yes.
Okay, and then we're also going to feel for the vibration in the medial malleolus. Okay,
Yes.
do you feel that vibration? Okay. All right, so that is intact. Then we are going to check vibratory response, and then we're going to do check for Romberg. So if you will stand for me, I want you to stand and hold your arms out and close your eyes. All right, and and we are looking to see that, see if the patient sways or not, and she is able to hold her balance good, so, this is a negative Romberg, okay? And then I want you to take 4 steps forward. We are checking for regular gait, and then turn around and walk back towards me, heel to toe. 4 steps, heel to toe, and that is tandem gait. Okay, and then turn around, I want you to hop on one foot. Okay, and then hop on the other foot. Okay. Alright, and have a seat. Okay. I did forget to assess for the hearing. I forgot to do the Weber, the Renee, and the, did I do the Weber Renee? Okay, this completes my head to toe assessment.